We run Frailty Assessment Unit, which is part of a combined frailty hub which encompasses care and provision from local authority, primary care, the local CCG and the hospital setting. We endeavour to support older patients living with frailty home on the same day wherever possible. Obviously there's a cohort of patients who are acutely unwell and have to come into hospital, but for others whereby they may prefer to receive the care in a community setting, or it's more appropriate for them to receive the care in a community setting, we will do our utmost to get them home.
We link in quite closely with the Frailty Assessment Unit within the department itself, and it really speeds up that process of getting these patients who don't necessarily need to be in hospital but might need looking at the polypharmacy, the OT, physio, and all that gets sorted here within the Frailty Assessment Unit, so we've seen it as a real big advantage to us here within the A&E. But recently I've been able to have the opportunity to go for an observer shift with the ambulance service and witness the ability of the paramedics to directly refer and assist with that process again, to get the guys seeing these patients seen quicker within the Frailty Assessment Unit.
We are aware that people living with frailty are more prone to hospital-acquired harms such as deconditioning, infections, pressure ulcers and dehydration. Evidence supports that ambulatory models are a good way to get patients home on the same day and reduce the risk of these hospital-acquired harms in older patients living with frailty.
The unit's led by a multidisciplinary team. They see the patient from a holistic view and they try and get them out that day, reducing mortality rates.
I support the older people who come through the unit in completing the comprehensive geriatric assessment. I assist with the nursing aspects of the assessment and also with the therapy aspects of the assessment.
My role on the unit is to support patients in promoting their independence in daily tasks, so that can range from anything from washing and dressing, preparing meals, doing shopping, walking the dog, or even gardening. The big emphasis is on promoting their independence in these tasks from a physical, cognitive and emotional point of view. And it's all about just living well with frailty.
We support the older person with frailty to promote independence out in a social environment in their own home. We promote with washing, dressing, with meal preparation, with exercise tolerance, with their mobility, and we work in a multidisciplinary team, reporting back to the frailty unit here and working closely with therapy. We also provide therapy and nursing skills within the home, providing a wider range of support to the frail person to enable them to remain at home.
My main role is to take a medical history from the patient and to do a full examination, to take bloods, ECG, to interpret results, or to ask physicians to order other tests as needed, and to help formulate a plan for the patient.
So we always do a comprehensive geriatric assessment, and we focus on the social, psychological, functional and medical concerns that the patient are having. My role is to make sure discharges are safe. My main role is to make sure patients are treated with respect, compassion and dignity.